Thank you very much. Good morning, ladies and gentlemen. I would like to first thank the organizers for giving me this opportunity to be here today. So my talk is about prevention. What do we know now about prevention of dementia, and what do we need to know more? I will start with this slide showing what could be achieved with prevention of dementia. I suppose most of you know the upper black line showing that the number of people with dementia will increase. It will triple in the next 40 years. There will be more and more people in old age, and if all other underlying factors remain the same. The lower green line shows what would happen with the future number of people with dementia if we could postpone the onset of disease by just 2 years. So the expected number of persons with dementia would reduce at least 20%. And if we could postpone the disease even more, then the reduction would be more. So there's a lot to achieve if only we would know how to prevent the disease. To prevent, we have to know something about the underlying factors. I will show you some details about different risk factors and protective factors. But this picture just shows in a nutshell that Alzheimer's disease, it's complex, it's heterogeneous. And besides genetic factors, it's the accumulation of different environmental risk factors and protective factors during the whole life course that influences if we will get dementia and when we will get dementia. This also is quite nice news in terms of prevention, that it will give us many targets and many time points for preventive actions. There has been quite a lot of longitudinal observational studies assessing different risk factors and protective factors behind dementia and Alzheimer's disease. If you look at the list of risk factors, those that are marked with green have a little bit more evidence behind them than those that are marked with black color. But you can see that there are many, many similar risk factors that are behind cardiovascular diseases as well. There's obesity, hypertension, hypercholesterolemia, smoking. What is nice news is that the list of possible protective factors is getting longer and longer. So there might be lots of things in your lifestyle, in choices you make, in your diet, that could possibly influence your future risk of dementia. But it's not as simple as that. The role of the relationships between different risk factors and dementia depends on the time point when you assess the associations. So, for example, high blood pressure at midlife is related to increased risk of dementia later on. But then during the development of the disease, the blood pressure declines. So in the end, if you compare people with Alzheimer's disease, people without Alzheimer's disease, so those that have the Alzheimer's disease actually show lower blood pressure levels. So there's this question of reverse causality. And similar kind of associations have been shown for cholesterol, blood pressure, obesity. So life course perspective, it is needed when assessing the risk factors for Alzheimer's disease. Genes and environmental factors, they interact. This slide shows some results from our Finnish case study, showing that the effect of different risk factors is different depending on the genetic susceptibility of the person. In the graph, you see the blue bars. They are for those people who have this quite common susceptibility gene, APOE4. And among those people who have this risk factor, the effect of unhealthy lifestyles is much stronger. The effect of lack of physical activity, of unfavorable dietary fat intake, of frequent alcohol drinking and smoking the effect is greater in those with the genetic risk factor as well. On the other hand, this is good news, because even if you have the gene, you can possibly influence your risk with choosing healthier lifestyles. Then just some examples of single risk factors. There have been many, many studies. But this slide shows that engaging in regular physical activity in midlife reduces your risk of developing Alzheimer's disease and dementia later on by 50–60%. The midlife physical activity is also directly linked to the brain changes later on. We do not know exactly the mechanisms. One proposed mechanism is the brain-derived neurotrophic factor, which is increased with physical activity. Another example of different protective factors, this is one of my favorites. This comes from the Kungsholmen project, where the participants were 75 years or older at the beginning of the study. And here, the study showed that people who engaged regularly in mental, physical, or social activities had a reduced risk of developing dementia later on. Of course, many activities have different components, just like dancing. You have mental, you have physical, you have social in that. But then, a person is much more than just one risk factor. Each of us has a set of different risk factors and protective factors. That is why we developed this dementia risk score, trying to put together some of the central risk factors behind Alzheimer's disease. Here in this example, we have a 50-year-old person with some some risk factors: high blood pressure, obesity, high cholesterol, not physically active. This person gets 13 points on the score, and it's related to having a 16% risk of later developing dementia. Now, if this person would have just one risk factor less, then the risk would be much lower. Now, the purpose of this instrument is not to give an individual a specific estimation of his or her risk later on, but I see this more as a sort of tool to speak and raise awareness of different risk factors that are behind dementia. Trends in different risk factors change over time. Here are just some risk factor trends from the National FinRisk study, where we have followed the Finnish population for now 40 years, since the 70s. We have seen quite dramatic improvements in cholesterol level and smoking, but on the other hand, negative trends in body mass index and alcohol intake. Many of these trends are seen in many other countries as well, but also there's some variation between different regions. But this is just to show that persons who develop dementia today, they have a different risk factor history than those persons who will be at risk of dementia in 20 years. And currently, we do not have really data to try to estimate what will be the effect of these risk factor changes to the occurrence of dementia later on. We do not yet have that kind of data to explore this thing. There are, however, some indications. This is a quite recent study from England, the CFAS study, showing that actually the age-specific prevalence of dementia has decreased over the past 20 years. It doesn't mean that the number of persons with dementia has decreased because there are more and more old people, but the prevalence has decreased. So the increase in the numbers of people with dementia was not as dramatic as it could be expected. There have been similar kind of indications also from the Netherlands, from the Rotterdam study, from Kungsholmen, Sweden. I think this is one more evidence that the risk factors are important. And even if we do not know specifically what was the cause behind this decrease in the prevalence, but there is something that we can possibly do. So I take this as an evidence that we have to keep on looking for the good preventive methods. Now, the real hard evidence on showing that an intervention to prevent dementia works, it should come from the randomized controlled trials. But here the evidence is really lacking. We do not know yet much. There have been trials with single drug or other drug-like agents, like the current Alzheimer's disease drugs. They have been given to people without Alzheimer's disease, seeing if that would prevent them. It didn't work. Same goes for some other drugs, antihypertensive drugs, statins, estrogens, some vitamins. It doesn't mean that these are necessarily not effective. Perhaps the studies were not long enough. Perhaps it was conducted in too advanced stage. Maybe that wasn't the correct time point. It's just to say that we still don't know how should we go about the prevention. There have been very few lifestyle randomized controlled trials. There have been some positive indications showing that physical activity might show some improvement in cognition. Same goes for cognitive training, and some dietary factors might be important. None of these studies has shown actually that these interventions would reduce the risk of dementia or Alzheimer's disease, but some positive signs. Actually, all of these previous trials, they have focused on single risk factors. Now, if we think about Alzheimer's disease, there are so many risk factors and protective factors behind it. So, at least to me, it makes sense that an optimal intervention should focus on several, if not all of these risk factors. Such trials have not been completed yet, but there is something ongoing. And I would like to present you with the last few minutes a trial that we are conducting now in Finland. It's called the Finnish Theoretic Intervention Study to Prevent Cognitive Impairment and Disability, or FINGER. It is a 2-year trial, quite long compared to many other trials. And we have 2 groups in our trial. We have one control group, and then we have a group that receives a very intensive intervention that consists of 4 different parts. It has a diet part, physical activity part, cognitive training part, and also intensive monitoring and management of vascular risk factors. We thought that it might be more effective if we start earlier during the disease course. So our participants are quite young. They are from 60 to 77 years of age. And they have some risk factors so that they have slightly increased risk of developing dementia. The 2-year intervention period will be completed at the beginning of next year. So in a year we would know what happens in terms of cognition. Is the intervention effective? But of course we are speaking of quite young people, so we expect that we need to follow them up for 7 years to see if this intervention actually also prevents dementia. But we are quite excited about this. Just something preliminary of where we are going. We are very happy that our dropout rate is only 11%, so people have kept up with the trial very well. In both groups, actually, the dropout rate is equal. People have participated quite actively. In the diet part, more than 90% participate regularly. In the other parts, a little bit less. They are also more intensive for the participant. So we didn't expect to have 100%. We are quite happy with this, but we'll see later on if this is good enough participation to have actually an impact on cognition and dementia. Something about the results, we have not peaked on the cognition yet, but we have looked at the changes in the diet from baseline to 1 year. And we have seen that in the intervention group, there are many positive changes. The dietary intake of fats has improved, so less saturated fats, more polyunsaturated fats. The intake of fiber and several vitamins has improved. And this has not happened in the control condition, so we are doing something. And the participants are quite happy to participate. More than half of the intervention groups say that their experience is positive, and all the remaining people say that it's the 50% say very positive, and the remaining say that it's positive. So none of them is very not happy about it. And as you can see about the comments, like the first comment from the intervention group, I have friends who are jealous when they hear all that I have been offered to do at this course. They still feel that they are on a course, so it's not easy. But even the participants in the control group feel that they do receive something. The last comment is from a participant in the control group, saying that coming here has always given me reinforcement and strength to take care of myself and others. We hope that with the finger study we can answer to many questions eventually, but of course the way to go on is to work between different studies. Currently there are 2 other European trials, multi-domain trials, to prevent dementia. There's the pre-diabetes study in the Netherlands and the MAP trial in France. And already now we are joining our forces. We are trying to do the pooled analysis to understand what is working well with the interventions. We wish to learn from each other and to do even better and multinational randomized control trials in the future. So to conclude, can we prevent or delay dementia? I think we don't know for sure, but there are some key things that are important. It's important to keep control of vascular risk factors and be active and maintain an active life during the whole lifespan. And even if we don't have the randomized control trials evidence, I think it's still the safe bet to have healthy diet, to have physical activity and cognitive training. And this last slide is just to acknowledge our funders and our really big group of experts in Finland and Sweden, whom I'm very happy to work with. Thank you very much.